You might feel pain in your pelvis. Feeling pain, strain, leaking, or heaviness, those are all signs that something is not quite right. When it comes to pelvic floor and birth, just all things women's health, there's not a lot of education. All those ground reaction forces go up the chain to your ankle, to your knee, to your hip, to your pelvic floor, and your low back. If you have a cushioned shoe and your foot is too stiff to absorb that, those muscles and joints aren't working as they should. So we're not getting a lot of geometrical angles for our hips to begin with, essentially turning off the glutes from working for you and also putting a lot of strain on the back of the pelvic floor, which leaves the front of the pelvic floor at a disadvantage and oftentimes can contribute to more leakage or downward pressure, so potentially heaviness or prolapse symptoms. I want to work with people who want to get better, not people who are just relying on the system or relying on medications to feel better. Like, there's a better way.
Welcome back to the Restore to Explore podcast. Today's episode is one I'm really excited to share. We're joined by Natalie Heddings, who is a women's health and wellness coach with a special interest in pelvic floor function. And her work blends deep anatomical understanding with practical tips that help people reconnect with their bodies. And in this conversation, we explore the deep connection between our foot function and our pelvic floor health, and how our modern lifestyles, sedentary habits, and footwear choices can quietly erode the strength and awareness that we're meant to have in these foundational systems. We unpack how breathing, balancing, and simply paying attention can start to restore what has been lost, especially for many women navigating pregnancy, birth, and postpartum recovery. This is a really powerful and empowering conversation, and one that will deepen your perspective on pelvic floor function and reframe it as a trainable skill that you have much more control over than you think. So let's get into it.
And before we go, we did want to let you in on one last little secret too. Do you want to know one of the most powerful things that you can do for your foot health today? It's changing your shoes. We are probably preaching to the converted. A lot of our listeners are probably well aware of the benefits of natural footwear, but we want to reiterate that most modern shoes are too narrow, too stiff, and too cushioned, which means they don't let your feet move the way they're designed to. That's why we're super proud to be partnering with Vivo Barefoot, one of the leaders in natural footwear globally. Vivo Barefoot makes footwear that's foot-shaped, flat, flexible, and thin enough for your feet to feel the ground beneath them. And here at TFC, we believe that's exactly what your feet need to function naturally. We've personally been wearing them for years, and we've seen firsthand how powerful this transition can be for improving our own foot strength, posture, and performance. And we're really keen for you guys to try them out too. So depending on where you're starting from, of course, this transition does need to be slow and steady. We are here to support you with the training and education that you need through that journey. But if you are ready to make the switch to shoes that support the health of your feet instead of disrupting them, then you can head to the link in the description of this episode to explore Vivo's awesome range. Don't think Vivos are for you? Well, you can check out our footwear finder, where there's a heap of other trusted natural footwear brands from around the world with special discounts too. So all of those links are in the show notes.
Okay, Natalie, great to have you on the podcast.
Thanks for having me.
It's a pleasure. And we've had the pleasure of hanging out a couple of times in person this year. My first time meeting you was in Chicago at our play shop. And then you came along to our guide certification after signing up to be a pro. So, we've been talking and hanging out most of the year, which is pretty cool. But yeah, I'm really stoked to get you on and have a chat about all things, your story, first of all, and then get stuck into some things around the pelvic floor, which is your sort of area of major interest and expertise. And you've already done a couple of pro roundtables in our community of practitioners talking about the pelvic floor, which is awesome, and I've really enjoyed those. And I'm keen to get that knowledge and wisdom out to the people listening here on our podcast. So why don't we just start with your story with movement, feet, footwear, what got you into this space, any sort of injuries of note. It's always good just to start there, and we can go from there.
Perfect. Okay. Yeah. Where do I start? I feel like I've been in this space for so many years now. I will start when I was a kid, I was super active doing a lot of non-traditional sports. So I didn't do a lot of organized. I did play soccer for a season. I don't think I made one goal the entire season, but that's okay. So not a lot of ball sports, but I did swimming and lots of hiking as a kid. I live in Alaska, grew up here. There's lots of mountains available everywhere. So lots of cross-country skiing and biking, even synchronized swimming. That was another one of my sports, gymnastics and dance. And around the age of 12, 13, I started developing heel pain. And I was dancing ballet at the time, but I was also wearing Dansko shoes, the clogs that are just the slip-on, like they weigh a lot. And I got them because of ease of slipping the shoes on. But I also saw the commercial on TV for them, and they said they could improve your posture. And being the nerd that I was at like 12 years old, I was like, oh, I need to have better posture. So I probably need to wear these shoes, which is just so funny looking back now. But
that's a special 12-year-old to be that interested in posture.
Yeah.
That you wear those funny looking shoes.
I know. It was a trend for a while here, actually. So everyone was wearing them, which was very interesting. But if you haven't worn them, if you're listening, they are very wide in the toe box, which is like the only redeeming factor. But they do have an arch support. They're very stiff. And so I was wearing those as my primary shoe, and then also dancing ballet, not on point, just like the regular ballet slippers that are just, like a glove for your foot, basically, and developed heel pain. Went to the pediatrician and everything. And basically what they told me is you need heel support in your shoes and you should stop dancing. And that was the education that I got. And so I did those things. And eventually the support that I put in my shoes, just like the, over the counter little heel support, fixed the pain, which I was stoked about. But I didn't dance anymore, which was kind of sad, probably for the better in the long term that I didn't go on point with ballet and further screw up my feet. But I then had kind of an interest in like, okay, what do I do to support my feet to make sure that never happens again? Because it was so painful and I didn't like not being able to go and do all the activities with my friends because I was in pain, and that seemed out of place for a kid that age, right? So over the years, I decreased my activity level. But then probably closer to high school and college, I started running again. I started doing more sports and found a pair of, I believe they were Merrells. And I just liked the way that they looked. And what's so funny is like, I'm not a fashion person. I will never be a fashion person. I will never
say no. Never say no.
Okay, that's true. That's true. I was like, oh, this is the kind of shoe that I can wear. I like how it looks. It's not too bulky because I didn't like the look of bulky shoes. And if I could wear this the rest of my life, I'd be happy. And so that's kind of like how I approach trends. Like, oh, if I could wear this one black t-shirt for the rest of my life, cool. Relieves me from the stress of trends, right? So
I'm a bit the same.
Yeah.
I'm with you. Yeah.
Keeps it simple. So I started wearing those. I got a pair of 5 fingers. I don't know where that came from. It just kind of came out of the blue. And by that time, it ended up being plantar fasciitis or fasciopathy. Is that the correct term?
Yeah, fasciopathy. Yeah.
Sounds weird. So that was healed. I started exercising again and didn't have any issue. I think part of it was my hypermobility and also just potentially going through a growth spurt, and things were a little loosey-goosey in my feet. So moving on from there, I got regular traditional shoes. So I had the minimal shoes for exercising, but then I had like regular cute boots and heeled shoes and all of that for regular life. And so I went to school. I became a doula at the same time. So I was 18 when I became a doula.
Wow.
And yeah. So also 12-year-old who's interested in posture and also helping pregnant women.
Yeah.
Started my career young. And I became a Pilates instructor at the same time that I became a doula. So at this point, I was doing my own exercise, didn't really have a lot of pain, thankfully, at that point, but then started to learn about fascial connections through the Pilates studio, learned about the pelvic floor, and I was fortunate enough to sit in on a post-baby class that was taught by a local physical therapist, physio, and learned about incontinence and prolapse and diastasis recti and all of the common conditions and issues that happen or oftentimes happen when you are pregnant, give birth, postpartum, all of that. And then I started to see a trend in my doula clients. Like they're complaining of prolapse symptoms, they're complaining of leaking, and they're complaining of all of these things that I'm hearing about in this other aspect of my life in my other job. And so I started to put two and two together. And at the time, I was going to school for nursing. That had been my life goal for a very long time. And I got to clinicals. This is all going to come together, I promise. It sounds like a long story, but I got to clinicals and all of the people were just asking for when they could have their next medication. And there was a light bulb that went off in my head. And I was like, you are sitting in the dark. You're laying on your bed. You're not breathing. Really, you're not breathing deep. You're not taking any responsibility for your health, like this particular patient that I was helping with my clinicals. And they were just asking, when is my next pain med? When is my next pain med? And so I had this like whole epiphany. It was like, I want to work with people who want to get better, not people who are just relying on the system or relying on medications to feel better. Like there's a better way. And I'm seeing this through my movement practice and my experience as a Pilates instructor and seeing people come out of my classes like a quarter of an inch taller or feeling like, oh, my shoulder pain went away just because of that class. Or I got Rolfed and I did all of these things and I was proactive and I felt better. And so that whole experience changed my perspective on life. And I was like, okay, I need to not go to school for this. And so I changed my degree to an exercise physiology degree. And I was like, okay, how do I combine doula work and exercise? And long story short, I was just Googling like fitness and doula. And my now colleague, Kim Bopney, who goes by the Vagina Coach, she was going by the fitness doula at the time. And so I took her certification and I was like, how do I become you when I grow up, essentially? And so what's full circle moment is, we now teach certifications together and we're colleagues. And so I basically fulfilled that, which is awesome. But I think like just experiencing those things and seeing how people can either choose to rely on like passive modalities, essentially, which are not all bad. Obviously, they have their place and nursing has its place and the system has its place. But people who want to get better and choose to do the work and choose to inform themselves and educate themselves so that they are empowered to make those changes, it's just like, it's amazing. And it really has shaped how I work with clients and how I educate. So that's kind of brought me to where I am today.
Yeah. And there's so much in that. I had a similar experience in the hospital system when I was doing my placements for physiotherapy. And I think I had a cardiovascular placement and a musculoskeletal placement in 2 different hospitals. And I definitely came out of both of those being very sure that I never wanted to work in a hospital. And it's not that hospitals don't do, I guess, a good job for what they're created for, especially in like the emergency context. But in terms of just the whole approach with disease care versus healthcare, which is kind of what you're getting at there, and is a big part of our philosophy is, yes, disease care is important when there is disease present, but it also needs to be combined with and sort of led towards a healthcare, an active, empowering healthcare approach. And I think unfortunately, a lot of people don't get the education around, we're looking after this disease at the moment, but you also need to look after your health. A lot of it is just, here's the treatment or intervention to manage the symptoms of this disease and come back if you have more symptoms, basically. So,
especially in women's healthcare, especially when it comes to pelvic floor and birth and just all things women's health, there's not a lot of education, which is unfortunate. It's changing. I think it's changing. Like it's becoming more mainstream, and like menopause, perimenopause is definitely a buzzword right now, which is awesome. But we still definitely have a long way to go.
Absolutely. Yeah. And so let's get into that. Obviously, there was a lot in there around your story with feet and footwear, and I'd like to connect that into this topic of women's health, pelvic floor health. But what do you think are the biggest pieces of education that are missing, that most women are missing, or most, I guess, people as well around their pelvic floor? Or what are some common myths that have been perpetuated that maybe aren't serving people that have that we now know better, but maybe are still circulating in traditional scenarios?
Yeah. Oh, that's a good question. So one of the biggest myths, I think, is that once you become a mom or you have kids, you just will have pelvic floor issues. Like, welcome to the club, you leak now. And like no one ever told me that before, but now that I have been in this situation a lot, I hear that a lot. Like, why didn't anybody tell me this before? So that's one of the biggest myths, which is incorrect. It's a falsehood. You definitely can have a life and have a pelvic floor that is resilient and strong after having children, or even before. Like, even if you're having issues prior to, or you've never had children, you can still have pelvic floor dysfunction, and men obviously can have pelvic floor dysfunction as well. Another one of the myths, I think, is like, once you have prolapse, you can't do anything about it. Like, you just have it forever until you either A, are tired of it, or B, done having children, or have too many symptoms and you just want surgery. I feel like, surrounding feet, like, especially during pregnancy, like, oh, your feet are going to grow bigger during pregnancy. It's a really important time to have arch support. I hear that a lot, which is very interesting to me. It's like probably the best time to go barefoot, honestly. Yeah, I would say like just for keeping it simple, those are a few of the ones that I hear that are still going around.
Yeah. And so for that first one is, if you have kids, if you give birth, then you're going to have pelvic floor issues. Welcome to the club, that kind of thing. So, is that the case? Is the case that people just haven't been, I guess, rehabilitated properly? Is it an issue with the birthing process? I imagine it's probably multifactorial, but why is it that people get pelvic floor issues after birth, and what are some steps that they can think about, say, during pregnancy or leading up to pregnancy, during pregnancy and after birth, that can help with that?
Yeah, big
help
question. That's a huge question. I would say, okay, one of the main reasons that people get issues is because of our sedentary culture. So you grow up running around, doing sports, whatever, and then you go to school, you go to university, and you sit for hours and hours and hours, and you aren't as active anymore, typically, like the typical person. And then you get a desk job and you're sitting 9 to 5. You're driving to work in your car, sitting, or you're riding transit, you're sitting. You work all day at a desk, sitting. You ride back home, sitting. You sit on the couch to watch TV, and then rinse and repeat the next day. And we don't have variability in our movement for the general population. So we're not getting a lot of geometrical angles for our hips to begin with, which stretches and moves our pelvic floor in different ways. Like, if we are just sitting 90, 90, 90 all day long, right? That's only one variable for those muscles. And so that's number one, like sedentary culture. Number two is heels on our shoes. If we're standing on ramps all day, then that automatically puts our pelvis. I have several pelvises here too, if people are watching the video. It puts our pelvis in a posterior tuck. So like you're tucking your tail between your legs, like a dog, embarrassed dog, right? Tucking that direction, probably squeezing your glutes and essentially turning off the glutes from working for you, and also putting a lot of strain on the back of the pelvic floor, which leaves the front of the pelvic floor at a disadvantage and oftentimes can contribute to more leakage or downward pressure, so potentially heaviness or prolapse symptoms. Then 3 is pregnancy is a huge endeavor. If you are a sedentary person, you're not moving very much, you're not very healthy to begin with, and then your body undergoes so many hormonal changes, physical changes, emotional changes during pregnancy, birth, and postpartum, that's a lot of strain. I mean, birth, a lot of people say birth in and of itself, no matter how smoothly it goes, can be a trauma to the body. It's a stretch injury, right? If you have a vaginal birth. And if you have a cesarean, you have an incision. And so you have been cut through those muscles of your deep core, which definitely affects your pelvic floor as well. So pregnancy in and of itself, like you have at least 25 plus pounds. I don't know the equivalent in the metric system. Sorry.
About half-ish, 12 kilos or something. Yeah.
Right. I should think of a barbell math. That would help me. We do kilos for that, which is funny. So you have that pressure on your pelvic floor, added weight. So if you're already in a non-optimal strategy of sitting, walking, moving, squatting, and you have maybe like a non-optimal length tension relationship with the muscles of your pelvic floor, which we can talk about, then adding load to those like non-optimally aligned muscles is just going to further increase any dysfunction that's already there. So it doesn't necessarily mean that pregnancy causes new dysfunction. Sometimes it just highlights what's already been there for years without you really knowing it. And then I think I'm on number 4. Birth in and of itself, birth is wild, and there's a lot of controversial things I could say, but depending on who you are, depending on your philosophy on birth, depending on who you select as your provider, depending on like home birth, birth center, or hospital birth, there's so many different factors that go into how your body moves through the stages of labor and then pushing your baby out. If you ideally can keep pushing for the first baby at least under 2 hours, that can reduce potential nerve damage and tearing also for your perineum. If you're over 2 hours, which I've known people to push for greater than 4 hours, which is wild and like more power to them, but also that's a long time of that kind of strain on those muscles that can potentially cause issues with those muscles healing after birth. With cesarean too, then you have incisions and you have to heal from a major abdominal surgery. So whether you're having a vaginal birth and you end up with tearing, maybe you're pushing on your back really hard and you're doing coached pushing, and you're pushing too fast, or your baby comes out too fast, because that happens sometimes. Those tissues don't get time enough to stretch in the correct way. So you may end up with some tearing. Tearing isn't the worst thing in the world. A lot of people are worried about it. I just want to say that, like, sometimes it's the thing that allows you to have a vaginal birth, and that's awesome. And you don't always need stitches and all of that. But you can have significant tearing that can go all the way down into your anal sphincter, which you can imagine cause problems for, a long term. So birth, how it's treated, how you view it, who your provider is, all of those play a major role in your body's response to birth. And then how you're also, number 5, how you also recover postpartum. Like in America, our culture is get up and go as soon as you possibly can. And that is changing somewhat. But women who get up and like serve everyone who comes to their home immediately postpartum. That's glorified. Women who go and run like at their 6-week at their 6-week postpartum checkup, like actually go for a jog or a run. The body is simply not ready, and we're not honoring that healing process. In a lot of other countries, they have like a 40-day or a 30-day resting period where everybody else serves the new mom rather than vice versa. And so, like, if you think about it, you push a baby out and your pelvic floor has stretched. It needs time without gravity pulling on it to heal and return to its original space and tension. So if we're up on our feet, baby wearing, carrying things, and I know that it's difficult for a lot of people who already have children, right? And don't have a village and don't have people to support. But yeah, I think the lack of postpartum care and education also is a huge part as to why people are having issues, because they're not letting themselves heal appropriately. Yeah.
So definitely a massive question that I hit you with, and of course multifactorial answer and very individual and context specific. And I think from what I'm hearing as a whole, you could wrap all of that up into, our separation, I suppose, from the way nature intended, or the way we've evolved to do something such as pregnancy and birth, and the context within which that happens. Maybe we could go through those, or at least some of those points in a bit more detail, and even bring it further back to, I guess, the function of the pelvic floor. What is the pelvic floor? How does it integrate with the rest of our body? Building on that topic of our sedentary culture. So clearly we didn't evolve the need to even think about our pelvic floor. It would just work naturally, similar to our breathing, similar to pretty much every other aspect. If we move naturally in a natural environment, then our pelvic floor function develops as part of a normal movement system. And, a lot of issues as you've said, a lot of the issues within pregnancy or postpartum come on the background of a lack of natural movement, which is something we talk a lot about on this podcast, especially as it relates to feet. But obviously that lack of movement, quantity, quality, variability affects every part of our movement system as well, not just our feet. So I'm interested, let's go sort of one step back to what is the pelvic floor. We have done an episode on this before with Petra Fisher, but there's potentially a lot of new listeners, and that was a while ago. So I'm keen just to get a revision on, what is the pelvic floor? How do we think about it? How does it integrate with the rest of our body? And that can then lead into the connection with our feet.
You're really good at massive questions. I'm just going to tell you. Which is great.
I just lump you with the massive questions.
Yeah,
but,
perfect.
Yeah.
It's perfect. So, okay, if we start talking about what the pelvic floor is, we have to talk about what the pelvis is to begin with. So This is Polly, if you're watching. If you're not watching, you're just listening, you can just put your hands on your hips, or either way, you'll feel the bones underneath your hands. That's your pelvis. You have two main sides of your pelvis. You also have a sacrum and a tailbone in the back. And you can rock back and forth if you're sitting and feel the sit bones underneath you. And then the front of your pelvis is actually a joint, so your pubic symphysis. And it's a mobile structure, which I think surprises a lot of people. We kind of think of our pelvis as like a fixed one bone, essentially, but it is multiple and it can move, thank goodness, to allow us to walk and run and jump and have babies and all the things. But we also need stability for the movement of our pelvis. So if you think about the tailbone, the pubic joint, and the two sit bones as kind of like a diamond shape, everything inside that shape, that space on the bottom of your pelvis, is considered your pelvic floor. So, and then I have a muscle
So it is like
muscle model.
a floor of muscles
Yeah.
at the bottom of your pelvis.
Yes.
Hence
And
pelvic
there's
floor.
exactly. It's interesting because if you think of a lot of the muscles in our body, like our biceps and our quads and our hamstrings and our calves, they run vertically, right? Up and down towards our head and our feet. But the pelvic floor runs horizontally. And so it reacts to gravity in a different way. And it's a web of 15, 16 different muscles, depending on how you count them. 3 distinct layers. So the first superficial layer is, you can think like the external sphincters, the closers. You can think with your brain to close them or open them. So essentially a kegel, right? Or if you're trying to not pass gas when you just had a
very handy still.
Exactly. If you're a nice person, right? You've probably done that. So the middle layer is the involuntary sphincters, so things you can't control with your brain. And then the deepest layer, there's even more muscles in there. Some of them are also deep internal and external hip rotators, which, like, you think about your hips and you think about your pelvic floor. Sometimes people disassociate those two. But if you have a hip mobility issue, like, you can really see how close, like, this is your socket joint for your femur, right? How close your pelvic floor is to those muscles. And then, of course, there's a lot of additional hip musculature and glute musculature that is not on this model. But essentially, your pelvic floor works like a trampoline, ideally. Ideally. So if you are standing, if you're sitting right now, you can kind of think about your pelvic floor as, you could think of it as a bowl. Sometimes that helps. You could think of it as trampoline. If you're thinking of a trampoline, this one is easier for me to visualize. You have, the metal rim around that trampoline, and then the springs, and then the netting. I know you just got one, Jim. So you've been bouncing.
Been having a lot of fun.
That's great. So if your bony pelvis is the metal rim of the trampoline, your ligaments and then those muscles are the springs, and then the main part of those muscles in the middle are the netting of the trampoline. It works the same way. It extends and lengthens and kind of bulges in a way down, for lack of a better term. And then as it activates, it shortens and lifts up towards the crown of your head. So all of those muscles should work in synergy with each other. Sometimes you can have, maybe you broke your tailbone. Maybe you sit with your legs crossed one direction always and never change that. Maybe you have, more tension on one side or the other. Then those muscles might have more of a problem working together in synergy, as if your trampoline went through a windstorm and had the frame kind of wonky a bit. So if we have an ideal functioning pelvic floor, we don't really think about it most of the time. Right? And it keeps us from going to the bathroom when we don't want to, keeps us from not passing gas when we don't want to. It keeps us breathing well, and it keeps us moving and stabilizing our pelvis well. So if we have dysfunction in our pelvic floor, we might notice leaking with coughing, sneezing, jumping, running, lifting something heavy. We might feel heaviness in our pelvic floor, like something's going to fall out. Or sometimes people will describe it like sitting on an egg, which could be a sign for prolapse, which I can go into detail on any of these dysfunctions if you'd like. You might also have diastasis recti, which is that separation down the center of your abs, the linea alba, that also is related to pelvic floor dysfunction, even though it's more of a deep core dysfunction. You might feel pain in your pelvis. So if you're feeling pain, strain, leaking, or heaviness, those are all signs that something is not quite right. Your body's trying to tell you that, okay, maybe there's some dysfunction going on. But the pelvic floor is really the bottom of the core. So our core, like if you think about all the exercise classes, if you've attended and people say, activate your core, right? What do people generally do?
Tense their abs.
Yes. Yeah. In like a,
yeah.
And it squeeze from the middle as much as possible, right? Like I think of toddlers pooping. filling your diaper kind of movement, right? And that's exactly what we don't want. It's a non-optimal core recruitment strategy. We want the deepest layer of abs. We want the bottom of the core, the pelvic floor, to lift and engage. And then our transversus, which is the deepest layer of abs, kind of like a corset surrounding, going from if you trace it with your fingers from your bottom rib in the back, your top of your pelvis, all the way to your sternum, and then your pubic joint as well. That muscle group, it holds you together, stabilizes you, and keeps you connected. If you go to reach for a ball that your kid has thrown at your head, or try to catch something, or you slip on the ice. People slip here all the time. You're slipping, then your transversus should turn on. If you're sneezing, if you're coughing, if you have your hand on your belly and you laugh at some funny joke, right? You'll feel that reflexive moving back and in. That's the transversus working. What happens is people tend to engage that, and they also engage the more superficial abs like the obliques, and they squeeze without thinking about the pelvic floor. And if you've done that for years, or every time you laugh or every time you cough, you're subconsciously doing that, then it's almost like squeezing toothpaste tube from the middle without the cap on. You have excess pressure coming down into the pelvic floor. So it really does matter how your pelvic floor is working. And like you said, if we had like variability and natural movement, and we grew up moving how we were supposed to move, then we probably wouldn't have that kind of patterning. But a lot of things can disrupt that natural and perfect timing of our deep core. And so we have to retrain it, and we have to figure out what it's doing before we can realign and re-synergize those muscles, if that makes sense.
Yeah, I think it is really important for people to understand the core, what the core actually is, because I think people do, as you say, people have an idea of my core is the abs that I can see. But really, like you say, the deep core consists of, more of that corset muscle, pelvic floor, even the diaphragm forms part of the deep core. And when trained, it's an interesting thing, because as we've talked about, it should work naturally. It should work, I guess, reactively. If you need to stabilize, then your deep core should just switch on without you having to consciously think about it. But if there has been something that's disrupted that, whether that's an injury, whether that's a process of pregnancy and birth, or cesarean section, anything like that has disrupted it, if we can consciously retrain it, then we should be able to progress. When we consciously retrain all of the elements together, then those elements can work together unconsciously,
Exactly.
hopefully in the future. So what's been your experience sort of with taking clients through that process from, wow, I have no idea even what my pelvic floor is, or how to think of, or how to like train it, to then integrating it, and then to being able to go about their daily life or their training without having to think about it. And I guess, what maybe any results that stand out, or that people can expect from going through that training process if they do have pelvic floor issues.
Yeah. So it all starts with the breath, no matter who you are. That's where I start with people. Generally, I do a series of tests. I look at their posture. I look at how they're breathing. But the retraining process does start with a diaphragmatic breath. And for everyone listening who didn't listen to Tom Williams' interview, you should, because he talks about this as well. And he also mentions the pelvic floor, which I was very excited about. A diaphragmatic breath is that 360 degrees inhale and movement of your rib cage outward. So rather than a chest breath or a belly breath, you're inflating wide and sideways into your rib cage. Your belly does expand some, and your pelvic floor should respond by lengthening or releasing, letting go. As you're exhaling, ideally the pelvic floor lifts, and sometimes we have to do that voluntarily with a little bit of a cue, maybe thinking like, you can think of a kegel. Most people do kegels incorrectly. You can think of, for women, pulling up and in with the vagina, thinking like sipping a milkshake through a straw with the vagina. That's a fun one. For everyone, you can think of an anal sphincter lift. So like you're trying not to pass gas, but avoiding any kind of additional clenching with the glutes or the abs. So just a gentle pelvic floor lift with an exhale, ideally rounded lip exhale, because of the fascial connection from really the toes through the inner thighs to the pelvic floor, to the transverses, to the diaphragm, and out the roof of the mouth. If you press your big toes into the floor and round your lips, you will probably, as you're breathing out, you will probably feel your deep core a little bit better, or be able to access those muscles more easily if you're having trouble finding them. So as you're breathing out, the pelvic floor lifts, the transversus stabilizes, and the diaphragm comes back down, or comes back in. It actually moves up. The rib cage comes back down, if that wasn't clear. So that kind of breath, consciously and slowly figuring out how to engage and have the deep core turn on, then integrate that with any kind of movement, whether it's getting up from a chair. So you start the inhale slightly before the movement, picking something up off the ground. So you're inhaling as you come down towards the ground. You start your breath, you find your pelvic floor, you find that stability, and then you keep breathing out as you lift the thing all the way back up. Whatever movement it is, I find that it's way more helpful to figure out what somebody is already doing in their daily life. I work with a lot of moms who are busy and don't have time to go to the gym and spend an hour on this. So they are doing the movements in their house throughout their day. So, okay, they're lifting their toddler up off the ground. They're going to practice that diaphragmatic breath with a pelvic floor lift on the exhale as they're lifting their kid. Or you're putting something overhead on a shelf. You're breathing out as you're doing that. You're finding that deep core connection. Over time, your brain will be like, oh, you want my pelvic floor and my deep core to turn on when I do a task? Okay, I can do that. And then eventually you get automated and you don't really have to think about it. So generally with clients, it takes maybe a couple weeks even to get the consistency and the timing of the breath. And then their body kind of takes over. Of course, if you are doing like a set of super heavy deadlifts and you want to consciously think about your breath, you can continue that. But ideally, you can lift your kid off the ground, you can catch a ball, you can do whatever it is without thinking, okay, inhale, release my pelvic floor, exhale, engage my pelvic floor. Okay, I'm good. Okay, now I can catch the ball, right? It's just not practical. So over time, it takes a couple weeks, and then it starts getting integrated into whatever movement the client is doing. If they're going to regular lifting sessions or doing an activity, they figure out a rhythm that works for them. And I would say, like, if someone is consistent with the movements, with the breathing, with the exercises, and the muscle release as well. I do a lot of like not manual, like self muscle release, like sitting on yoga tune-up balls and different things like that. They should see improvements in their pelvic floor dysfunction within a couple weeks. And if it's not going away, then something else is in the way. And so people generally stop leaking. They generally stop having urgency. They stop waking up in the middle of the night to pee. They feel less heaviness in their pelvic floor with lifting. They feel like they have more stamina to do like a full exercise session without their pelvic floor getting so tired. So they have more endurance in those muscles as well. They just feel overall better. And back pain goes away. Foot pain goes away. Hip pain goes away. Neck pain goes away. All of the things.
Which probably sounds, sometimes that can sound a bit too good to be true, but when you're talking about something as foundational as your deep core, very similar to the feet as a foundation for our body in terms of our primary interface with the ground, the function of our feet and the function of our deep core will definitely have overflow effects on the function of everything else. And obviously there's that pretty strong foot and pelvic floor relationship there, which I'm keen to delve into a little bit more. But it's really good and promising and encouraging to hear that this is possible to change and to train. And similar to feet, I think there is this perspective that the feet are just too hard to train, the muscles are too small, you can't voluntarily do things with the feet. And more we're finding with clinical experience and studies that that's actually not true and that they can be trained. Sometimes that training process takes a lot of conscious effort and it can be frustrating, and people have to move through this, the skill acquisition of going, being incompetent to being conscious, what's called conscious competence, where you have to focus, but you're able to do it if in a isolated setting. But then you build up to that unconscious competence where it does just happen automatically. And a good thing to think about is most people have learned to drive a manual car. At least when I was going through, we all learned to drive manual, even if we thought we were going to drive automatic. You learn, or in America you call it stick shift.
I absolutely have never learned to drive stick. I'll just tell you that.
Okay, there you go.
I'm the outlier. I'm sorry.
Yes, well, but yeah, maybe not the best example, but
not even for a right,
even without stick, even just learning to drive, when you're first learning, you're sort of both hands on the wheel, you're focusing on everything, you're taking everything in, your parent is there to, hopefully not berating you or anything, but you're having full conscious awareness and focus on the task at hand. And over time, you can start listening to music or a podcast or chatting to a friend, and maybe you start driving with one hand on the wheel. You're able to, if you're doing manual or stick, then your feet just do, push the clutch in, take it off, change the gear. All that stuff just happens while you can focus on something else.
Mm-hmm.
And so whether it's stick or automatic, most people have learned to drive and they've learnt some skill, and they now know, I can just go into unconscious mode with that skill while I focus on something else. Obviously, you don't want to focus on anything else too much while you're driving, but you get the idea. It sort of starts to happen more and more automatically. The good thing with the body is, and with all of this topic around the pelvic floor and the deep core, is that the body, that is what the body is programmed to do. It's how it's programmed to function. And so when you start giving it these inputs that push it or nudge it towards the way it's supposed to function, then it can adapt very quickly towards those inputs. And that's a big reason why we see people's foot function improve impressively rapidly, considering the context of wearing tight, narrow, rigid, cushioned shoes for decades. They can improve their foot function amazingly quickly because that is the way the body wants to organize. And some small regular inputs in that direction can make a massive difference, and then it kind of builds on itself as long as you're not continuing to disrupt the natural function, and it becomes self-perpetuating, which it sounds like is the case here with pelvic floor.
Definitely. Yeah. And the two go hand in hand. I didn't think I said, but I try to get every single client into minimal natural footwear because there's so much movement that can happen more naturally that contributes to pelvic floor health when you are barefoot or wearing natural footwear. So I don't know if we're ready to dive into.
Let's dive into that.
Do it. So there's so many different ways that the feet relate to the pelvic floor. The first one I mentioned, right, is like standing on ramps tilts the pelvis under. You have more tension in the back of the pelvic floor, less tension in the front of the pelvic floor. You're more prone to leaking. There was one study that they did ultrasound on the bladder neck. So if I pull my little bladder model, the neck of the bladder is down towards the urethra. So the the spout essentially of the bladder. They had these women standing barefoot and then increasing their heel height of their shoes. And then they did ultrasound on the bladder neck. They found more bladder neck distension the higher the heel became. And so they concluded essentially that it's harder, more challenging for the body to engage the pelvic floor and lift when you're in that compromised position in a higher heeled shoe. So they concluded barefoot was better for pelvic floor activation, which is awesome. And I'm sure we can probably link these studies in the show notes as well. So that's one of the main ways. The other one of the other main ways is just stiffness in conventional shoes, arch support in shoes, and how that limits the range of motion of all of the bones and joints in the feet and limits the ability of those muscles to get stronger. And so if you have a stiff, like meat pancake foot, then if you strike the ground and your foot is designed to absorb all of the forces, whether you're running or you're walking or you're balancing on something, and your foot is too stiff to absorb that, those muscles and joints aren't working as they should, all those ground reaction forces go up the chain to your ankle, to your knee, to your hip, to your pelvic floor, and your low back. So then you end up with all of these tiny little muscles of the pelvic floor having to deal with excess pressure and forces on them that they weren't designed to take. So they can't do their normal jobs. They're trying to do the job of the foot, essentially. And so then we see dysfunction because there's way too much tension, way too much force. It's like a shock on a car or a bike that's way too stiff. And so if you go over a huge jump or a bump, then your handlebars are going to rattle way more than if the shock absorbed the forces, if that makes sense. And so then you end up with rattling in your upper body, whereas you shouldn't have had that. The shock should have taken that force for you. If that makes sense, if that's a good illustration.
Yeah, absolutely. And the pelvic floor, yeah, obviously the body can compensate to a degree, and it's a master compensator. And if your foot is not doing its job, then the other areas are likely to, they're going to try to adapt to that scenario where the foot is not doing its job because it's essentially casted by a shoe that is stiff, narrow, pointy, etc. But there is generally a cost to that compensation, and over time that can actually lead to overload, which I guess is what you're referring to here. And also the foot interacting well with the ground and correct me, I guess, if I'm wrong here, but my understanding would be that all of the sensation, like, if we were going barefoot and our foot is functioning naturally, then all of the sensation and proprioceptive input and changes in fascial joint range of motion, fascial movement, etc., would be triggers to the pelvic floor and deep core to sort of fire in a certain way or activate in a certain way that would then support the foot and vice versa. And so if you take away that proprioceptive input, that sensory input, and the natural movement of the foot, then we don't actually get those signals up the chain for those that deep core to activate in the way that it needs to.
Exactly. Yeah, that's a really good point. And then we end up going in, our pelvic floor goes in blind to whatever it may be. And then it essentially could be startled, so to speak. And then you end up leaking because that force was unexpected to your pelvic floor. If you can kind of visualize that, like you're landing on your heel, maybe if you have a cushioned shoe, you're landing on your heel, everything is not ready for impact. And so the pelvic floor is maybe stiffened up and not allowing for that ebb and flow and that resiliency. And then you jump on a stiff trampoline, you end up with probably not the best results, right? there was a study that they did that I keep talking about every time I talk about this connection, because it's incredible. One, that they're studying women, and then two, they're studying pelvic floors and feet together in the same study. Makes me so happy. They took about 50 women. None of them had given birth. So that's something to consider. Hopefully in the future, we'll have more studies with postpartum women. They wanted to eliminate pre-existing pelvic floor dysfunction, essentially. And none of them had run in minimal shoes or made the transition to natural footwear. So they had them run at different velocities on a treadmill in a conventional shoe and a minimal shoe. And they had basically electrical probes on different parts of their body. They did femur rotation. I'm trying to remember all the different ones. They had a pelvic floor, so intravaginal probe measuring the activation of the pelvic floor muscles, which is the most important. And they found that in the minimal footwear, all of the women who had not transitioned yet, which was awesome, had greater femur rotation, better cadence. That's what they checked. They watched the cadence of their running. So a better cadence, which is more physiological, for like a natural running gait, essentially. They had the cadence that matched a more physiological gait. And they had greater pelvic floor activation with the minimal shoes than the non-minimal shoes, the conventional shoes. So they concluded that running or walking in minimal footwear was essentially protective of the pelvic floor for future dysfunction. Super cool.
It is super cool. Yeah. And again, it's one of these things where intuitively people understand that the body is connected and one area can affect other areas. It is really helpful to have studies like that sort of demonstrate that and I guess the depth of that connection. But also kind of paradoxically, people understand that the body is connected, but then they think about pelvic floor and they tend to think of kegels or is that how you say it? Kegels.
Kegel, whatever.
Yeah. Is it a guy's name?
Yes, Dr. Kegel.
Dr. Kegel, that's right.
Yeah.
And you mentioned before that people do kegels wrong. Some people do. Where do people get it wrong? What is the role of kegels? And any tips for people who are currently kegling? Let's dig into that.
Most people, I would say I think there was a study that was like 50% of people were doing them incorrectly. Incorrectly meaning they were bearing down and pushing out when they thought that they were engaging and lifting up towards the crown of their head. And so if you ask a group of people to do a kegel, probably half of them are pushing down instead of lifting. It's a neurological connection, a brain connection that you have to make. And a lot of people are also disconnected with that part of their body for various reasons. We don't like to talk about our pelvic floors. It's kind of a taboo area, depending on where you grew up as well. If your parents didn't talk about it, if you didn't talk about periods, if you didn't talk about sex, if you all of that kind of becomes a big black box of don't even think about that. And so a lot of my clients have been there as well. And so reconnecting your brain to that area of your body sometimes takes some time. There's a lot of different ways you can figure out if you're doing it correctly. You can, and I highly recommend, see a pelvic PT physio yearly, even if you're not having symptoms, because they can do internal exams and they can tell you, yeah, you're actually engaging and lifting those muscles. No, you're not. Oh, you have movement downward when you're coughing rather than an upward movement. A really good PT will also look at your foot function, be wearing minimal shoes themselves. That's my criteria. I tell people to call ahead of time, ask what kind of shoes they're wearing and if they have a squat rack in their clinic. And if they do, and if they're wearing minimal shoes, then you can go to them. now people are doing standing assessments, standing internal assessments. So if you want to squat with weight on your back, you're worried about your pelvic floor, maybe you're leaking at the bottom of your squat, but no other time, then they can do an internal exam while you're squatting with weight to figure out where the disconnect is, which is just really cool. So, and that can be the mind-body connection that you need to figure out how to change your strategy, engage that pelvic floor in a different way. So a kegel essentially is a engagement and a lift towards the crown of the head with the pelvic floor voluntarily. It should happen automatically, like we talked about, once you're automated. They do have a place. There's kind of been this wave of people on social media saying, like, don't ever do kegels, doesn't matter, like, just do other exercise and breathe. But in my perspective, it's important to know how your pelvic floor releases and lengthens and expands and then engages and lifts. And to be able to get that full range of motion, you have to learn how to activate that on your own and voluntarily to assist in that diaphragmatic breathing and then also retraining. You don't have to do 100 in your car while you're at a red light. Like that used to be the prescription, right? But they only work if you do them integrated with breathing and integrated with natural movement. If you're doing them isolated, it doesn't translate to normal life or movements.
Sure. So that's basically the process that you were talking about before, starting with the breath, integrating that with the lifting or the squeezing of that external sphincter voluntarily, and then integrated with some kind of movement, sit, stand, lifting, something like that. It sounds like people probably, some people who maybe have been doing the hundreds of kegels at a stoplight or, only doing the kegels, even if they're doing them right, then it sounds like they might need to actually learn to go in the opposite direction. And people who have been thinking they're doing kegels right, but have actually been, bearing down, as you say, need to learn how to go up. And it's similar to the foot, like there's not really a right or wrong. You want both options and you want to be able to go between them easily and within the right context. Is that right?
Yep, exactly. And oftentimes I would say maybe 90% of my clientele has too much tension in their pelvic floor. And I'm assessing that by how they're moving, how they're breathing, not licensed to do internal, so I don't do that, but I can tell that they have a tight pelvic floor. So what happens then is we still talk about kegels, but we focus more on the release range of motion. But there is still value in learning how to fully engage so that you can figure out where in space your pelvic floor is to start with, and then you can fully release. So yes, I would say primarily people are too tight, but there's still benefit in learning how to do one properly. You can also, there's a lot of devices on the market too, like the Bluetooth ones that hook up to your phone. You can play games. They're sensitive to pressure and lift, which is great. So you insert them vaginally and then connect to your phone and you do a little Mario game essentially.
Wow.
Yeah. So that can be more cost effective if people aren't, keen to go to a PT right away. You can also kind of just start to be a little bit more body aware. You can also insert a finger and feel if you're pushing down and out or you're lifting up and in.
And you mentioned you do some tissue work, like some, releases with yoga tune-up ball. I think you mentioned like a massage ball.
Yep.
I'm interested to know, so does that can help with the relaxation of the pelvic floor? You mentioned a lot of your clients have pelvic floors that are too tense.
Yep.
And they need to learn to relax. So by the sound of it, the massage ball probably combined with some breathing could help unwind some of that tension. 100%. Are there other places like, say, the glutes or do the feet? Have you found any connection there where releasing other areas of the body or massaging other areas of the body can help relax the pelvic floor?
100%. Yeah. Piriformis is a big one. I would say almost everyone needs a piriformis release.
Yeah.
I don't know what it is, if it's the external rotation of the femurs, if it's driving, people are externally rotating, if they're standing, trying to find some sort of stability because they're pushing their pelvis forward and tucking under, so their legs are more externally rotated, and that piriformis is an external hip rotator, tends to be quite tight. Lack of strength in the glute med is also tends to lead to tightness in the piriformis, is what I've found. So yeah, piriformis release, a posterior pelvic floor release. To grab my little ball. Basically, if you're watching, you're putting the ball right here. If you're listening, right between the tailbone and the sit bone, underneath your glute. So it's not on the outside, it's not on your sit bone, but it's like in the meaty part between one side of your pelvic floor and then the other. That one is everybody's favorite. You feel like you can fully feel your sit bones grounded on the ground afterwards. And that targets a lot of times if you tend to stand in a posterior tilt or sit slouched under with your pelvis. And then a foot release, always, 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 always. If we can get some more mobility in the feet, then you automatically see the tension let go. Like if you're watching somebody move, if you're watching somebody stand, there's a lot of tension in the back line the majority of the time. So the glutes, the hamstrings, the calves, and the bottom of the feet. And once you start, if you start with the feet, then it kind of just, everything chills out a little bit more. Yeah. So those are my favorites.
Yeah. I had a feeling, I mean, I don't work with, clients that have pelvic floor issues, but based on everything we were just talking about, but I actually don't see clients one-on-one at all, but I haven't worked, as a pelvic floor physio, but you're right. I think similar to foot dysfunction, there probably is a lot of pelvic floor dysfunction that goes unnoticed or unchecked until there is some kind of overt symptom. A lot of people have dysfunctional feet and they don't realize until they do something specific or have some kind of symptom that pops up, and then they're like, oh wow, but they actually had this dysfunction building up over probably decades. But yeah, I figured with that foot, the fascial connections, as we've been talking about between the feet, pelvic floor, deep core, and everywhere else, then it makes sense that improving that foot function can help everything else work more automatically or more efficiently. What about balance training? Obviously, we at the Foot Collective are very big into balance training. You've been training your balance a lot lately on the Soulmate as part of the guide certification, and obviously you just like it as well. But where do you see that fits in with this approach to feet, pelvic floor? Obviously, you work with people, like you've said, doing lifting and squatting, and those kind of integrated movements are really important. Yeah, how do you see balance training fitting in?
I would say, well, first of all, it's very fun.
Yeah.
And typically people who have pelvic floor dysfunction and who have been to CPT and it hasn't worked, or they've been doing kegels for years and it hasn't worked, they're very tense and serious about movement. And you get them on a Soulmate and they're like, oh my gosh, I can train everything and have fun while doing it. And it's a total stress reliever. And it trains your feet, it trains all of your joints in your legs, it trains your pelvic floor, your core, and your brain as well. And so it's like a full body. I tell people I could give you like 10 different exercises, or I can just put you on the beam or the Soulmate and we can have fun. And they usually choose the latter. So one of the things with balance training, though, is it trains reflexiveness without people worrying about their pelvic floor. Because most of the time people aren't leaking in a balance stance. They're leaking with a jump or a run or a cough, but they can get on a single leg stance or even a split stance and feel fine and not worried about leaking or having pain or whatever it is specifically with their pelvic floor. And so they explore more movement and they have more freedom of movement because they're just doing what they need to stabilize. And I find that to be like both to release a lot of tension that they're holding in certain areas, but then strengthen the compensations where they're not, or the places that are being compensated for that don't have any strength or have very little strength. And so it's like one of my primary go-tos, honestly. Once I teach breathing, once I teach like basic movement and ergonomics and lifting, like get them on a soulmate, get them on a beam, and it does wonders for core function.
Yeah. That would have been my hypothesis, because balance training, very, like you said, it very much highlights where people are holding too much tension. So if you try and tense up, which is usually people's reaction when they get on something that makes them feel unsteady, is they kind of tense up. And then the more they tense up, the more they have to step off, because you can't really balance while you're tense. It needs to be a little bit of a dance within your body. Even if you're not moving that much, there is this sort of constant dance going on between different muscles, and you move one way and these muscles fire, and you move the other way and these muscles fire. Whereas if you're tensing all the muscles too much, that goes for pelvic floor, goes for hips, deep core, superficial core, I guess. Then you'll get that feedback by, oh, I didn't balance. And then as long as you can find that, we call it the Goldilocks zone, just that sort of not too easy, not too hard progression for someone, they will be able to relax into that. And the other thing that it does is gets them to tune into their breathing, because the better you breathe with balance training, then the better you do. And the better you do, the better you feel. And so it is this sort of positive loop of everything that helps to align, or I guess helps to align the body in a way that makes it move more efficiently. And it actually really makes a lot of sense from a developmental perspective, because the first priority is learning to balance, whether that's sitting balance, standing balance, balancing while walking, running, jumping. As we grow up and develop our movement systems, then balance is like a central key to all of that. And it's training our balance as an adult, whether that's on flat ground or on a soulmate or a beam, puts us back in that sort of more developmental growth phase where we are learning to coordinate all these parts of our bodies together, but coordinating them unconsciously, and just using the feedback of, did I succeed or not? Yeah.
It also puts you into a beginner state without it being awkward. Like, it's fun, right? And everybody is at a different level. And I think we can accept that more easily than, oh man, I messed up the breath again. Okay. Oh, I can't kegel. Like, that is very frustrating. And a lot of people don't like to talk about their pelvic floors to begin with. But, balance work just automatically, it humbles you sometimes, oftentimes me. But it allows you to fail without feeling down about yourself, in the same way that, like, I don't know, a generic PT exercise, like I'm doing a bridge with the breath, you get a lot of like, oh, I messed up, like frustration with that, versus, oh, that was kind of okay, I fell off, I need to try something different. So it automatically puts you into more of a problem solving mindset than just like a right and wrong mindset, I guess.
And it also, something I found is it really increases the variability of movement that you're exposed to, because you could be doing a lift or a squat or something like that, and yes, there's variability between repetitions naturally, but with a linear movement like that, it's going to be relatively repetitive. Whereas you'll get on a balance beam and do a task, and you'll just expose your body to all of these different angles and ranges, depending on the task, depending on the stance that you're in. And it's a really powerful way to add in a lot more variability for your foot movements and for your overall body movement that you really just wouldn't get otherwise, except potentially some kind of sport. But then the sport comes with its own risks and potentially its own footwear that needs to have it in its own capacity that you need to have. Whereas balance training is very accessible to anyone. It could be, we have people coming into our classes that are 70, 80 years old, or 15 years old athlete, and there's always a way to meet those people where they're at. And like I said, find that Goldilocks zone, not too easy, not too hard, and then that improves over time. So that's probably a good place to wrap it up. I'm keen to leave people with some key takeaways, and so I'll list the ones that I've taken from the conversation so far, and you can add any more or give any clarification. But obviously, if someone has a specific issue that, whether it's leaking, like a specific symptom of dysfunction, leaking, prolapse, etc., seeing a pelvic floor specialist, whether it's a PT, physio, someone like yourself, exercise physiology, etc., would be the best bet. Sounds like transitioning to natural footwear would be a really good step, and we've got a lot of resources on our website and YouTube channel for how to do that sort of safely and effectively. But at least going, foot shaped, fixed, and then working down your way of flat, flexible, and having more feel in your shoe. Going barefoot more, just here and there at home if you can. If you don't have any specific issues that are stopping you from going barefoot, sounds like that would be a good idea. Incorporating some balance training. What else? What am I missing?
I like to remind people that it's never too late also, because I think that's also, with feet and pelvic floor, we hear that like, oh, I've had issues for years and years. Like, I'm past the time that I can improve. It's never too late to improve. So
yeah,
all of the things that you just
said.
mindset,
basically. Yeah. Start with that mindset.
Exactly.
And then look into those things. So, and it's kind of, it's good to know that you don't have to be doing something really specific for your foot health, and then something really specific for your pelvic floor health, and then something really specific for XYZ. Obviously, certain areas might need more attention at certain times, but as a general rule, if you transition to natural footwear, do some balance training, do some good basic strength training or resistance training, some massage, self-massage, or potentially even going and getting a massage. All of these things will help each other, and they can create that like self-perpetuating cycle. But I do love that you mentioned that, because mindset is such a key part of all of this, and too many people have sort of been beaten down by the dominant stories in today's culture of, you can't fix yourself. You're just gonna have to deal with the symptoms. We're gonna have to manage the symptoms, and often managing those symptoms comes with, some kind of recurrent cost, whether that's orthoses or surgeries and so on. Yeah. I feel like we could probably talk for a few more hours all around the intricacies of pregnancy and birth and all of that side of things as well. But hopefully we can do another podcast recording next time we hang out in person. I think that'll be fun.
That'd be awesome.
And until then, if people want to connect with you, or I know you run workshops, if someone wants to sort of have a session with you, where can people find you? Where can they connect?
On most all social media, I believe I'm at Trainer Natalie. There's an H on the end of it. So at Trainer Natalie H, and then trainernatalie.com is a great place. People can email me if they have questions, or reach out on social media, and we'll talk feet, pelvic floor, all the things in between.
Yeah. Awesome. All right. Well, thanks for your time, Natalie, and thanks for listening, everyone. We'll catch you on the next episode.
Thanks for joining us on the Restore to Explore podcast. If you enjoyed this episode and want to hear more, the best way you can support us is by leaving a review and subscribing wherever you are catching this episode. If you want more free TFC training and education, are after some of our training tools, some natural footwear discounts, or want more specialised guidance from a trusted TFC health professional, then thefootcollective.com is the place to go. You'll find all of the helpful links in the show notes.